Hello, my name is Anne Marie Ware, and I am a registered respiratory therapist. I help people breathe and I help patients who have asthma. So, in this video, we will be learning about how asthma is treated, what is asthma, how to know if your child has asthma, what will make asthma worse, how asthma is treated, the different types of asthma, how to take medications correctly, when to call the doctor, the importance of asthma features. So, what is asthma? Asthma is a treatable disease that makes it hard for some people to breathe. We have two lungs, one on the left side and one on the right side. Sometimes mucus and irritants like dust can get inside the lungs and make the airways collapse and tighten. If you take a straw and breathe through it, this is what it can feel like if you have asthma. What causes asthma? There are many triggers that can irritate the airway and make it harder to breathe. Colds, weather changes, allergies, and exercise are among the most common causes of an asthma attack. In addition, asthma can run in the family. Did you know that children are 3 times more likely to be diagnosed with asthma if their mothers have it, and 2.5 times more likely to have asthma if their father has a diagnosis of asthma? How do I know if my child has asthma? Some of the symptoms of asthma include coughing a lot during the day or night, when exercising, or when your child has a cold. Your child can also have a whistling sound when they breathe. If your child says that their chest is tight or that they feel like an elephant is on their chest, this is a sign that you need to schedule an appointment with your primary physician. What can make asthma worse? There are a lot of factors that can trigger asthma in children. For example, season changes can trigger an asthma reaction. Some children can react with the pollen in the air or the cold weather in the wintertime. There are also environmental instances that occur inside the home that can increase the chance of having an asthma flare up. How to combat triggers of asthma. Small particles of dust, pet hair, smoke, and carpet can be harmful to a child that has asthma. This is why it's very important to vacuum frequently and keep bedding and sheets clean at all times. Exercise can also increase asthma symptoms, but with the right treatments, kids will be able to do sports and exercise like any other child. Lastly, having a virus or cold can have an effect on breathing, so it is very important to communicate with your doctor when your child is having these issues. Working together with your primary care physician will keep your child breathing well and have their asthma symptoms under control. The different types of asthma. Did you know that there are different types of asthma? Each child is different, so they will need to be evaluated by their physician to determine the severity of their asthma. There are some children who have symptoms every day and they need to take controller medications to keep their asthma symptoms at bay. While there are also other children who only have breathing problems during certain seasons. The best way to keep track of asthma symptoms is to have an asthma diary. In this diary, you can record when your child is having symptoms and what they were doing before and after you noticed the symptoms. Were they bouncing on the trampoline or running to make a play in football? Were they in an area where they were being exposed to strong odors or fumes? Being very descriptive in this asthma journal will help your primary care physician give the best diagnosis and the correct treatment plan for your child. We have gone over a lot in this video, and I know that it can be overwhelming to process this new information. But know that your primary care physician will be with you every step of the way. You are not alone, and we want to help you and your child keep their asthma controlled so they can enjoy life. You may be thinking, so we have gone over the symptoms and the triggers of asthma, but how do you treat asthma? I'm glad you asked. Once your child has been diagnosed with asthma and the severity of asthma is determined, your child will get an asthma action plan. This plan will include the controller medications and the quick relief medications that your child will need for their asthma. What is a controller medication? A controller medication for asthma is taken daily, and this helps keep asthma symptoms at bay for a long period of time. One example of a controller medication includes Flovent, which is the brand name for a drug named fluticasone. Fluticasone is a steroid, and it helps keep the smooth muscles in the lungs relaxed. Think of the lungs as two big hollow trees that have branches, the airways, with rubber bands around them, and instead of leaves on the branches, there are balloons. These trees are connected, and when we breathe in, air goes into the lungs and it fills up the balloons. These are called air sacs or alveoli. The job of the alveoli is to exchange carbon dioxide, the bad stuff, with oxygen, the good stuff, in the bloodstream. This process happens every time we breathe in and out. Cool, right? So the job of the controller medication is to keep the rubber bands or smooth muscle relaxed around the branches, also known as the airways. If you miss a dose of your controller medication, this can cause the rubber bands or smooth muscle around the airways to get tighter and tighter, making it difficult to breathe. This is why it is important to take the controller medications consistently and as prescribed by your doctor. What is a quick relief medication? Unlike a controller medication that keeps the smooth muscle open over a long period of time, quick relief medication lasts only 3 to 4 hours. Medicine like albuterol keep the airways open for a certain amount of time. Your doctor may prescribe quick relief medicine to use when you feel your chest tighten up, you start coughing, or before vigorous activity. If you have questions of when you should use the quick relief medication, ask your doctor to clarify, and they will be happy to explain in more detail. So now you know the difference between controller medicine and quick relief medicine. Make sure to follow the doctor's prescription for when to take each medicine and how much to take. If you or your caregiver notice that you are taking your quick relief medicine more than 2 times a week, you need to make a call with your doctor because your asthma is not being controlled. One device that can make it easier to take your medication is using a spacer. A spacer is a small chamber that you attach to your metered dose inhaler, and it helps deposit the medication into your lungs. So, what is an asthma action plan? After your child has been diagnosed with asthma and the severity is determined, you and the doctor will come up with an asthma action plan. This plan explains when to take the controlled and quick relief medications. It also includes 3 zones: green, yellow, and red. Each zone is a guide, and based on your child's symptoms, you match the symptoms to the zone and do what is planned for that zone. Here is an overview of the 3 zones. The green zone. This means that you're doing well, you have no symptoms like coughing, wheezing, chest tightness, shortness of breath during the day or night. In this zone, it is important to prevent asthma symptoms by taking prescribed controller medicines every day, staying from triggers, and using a quick relief medicine before exercise if necessary. Yellow zone. In this zone, there are symptoms such as coughing, wheezing, chest tightness, and shortness of breath. Your child may be waking up at night due to these symptoms, and they can do some but not all usual activities. In this zone, you need to follow the plan set by your doctor, and if symptoms don't improve within the set time, then you need to make an appointment with the office as soon as possible. The red zone. In this zone, your child may be very short of breath and they have difficulty speaking without running out of breath. Also, the quick relief medications have not worked, or their symptoms have been in the yellow zone or have gotten worse after 48 hours. The red zone is the emergency zone. 911 needs to be called. When to schedule an appointment with the doctor. When being diagnosed with asthma, making sure to have enough medication and refills available is very important. It is essential to have open communication with your doctor and schedule asthma rechecks at least 4 times a year. I know your schedule is very busy, but think about what you will do when your child can't breathe and their medication is out, or worse, expired. Did you know that asthma is the 3rd leading cause of hospitalization among children under the age of 15 years? And that asthma is one of the leading causes of school absenteeism. In 2013, asthma accounted for an estimated 13.8 million lost school days in school-aged children with an asthma flare-up in the previous year. Think about the medical costs you will save from not going to the emergency room for uncontrolled asthma. It's better to have your child's asthma under control with medicine stocked in the medicine cabinet than to have an asthma attack happen and be unprepared. So don't forget to schedule an asthma recheck at least 4 times a year. And if you are short on time, Ivy League Pediatrics offers virtual visits to make it easier and more convenient. Thank you for viewing this educational video about asthma wellness and asthma control. I hope you and your child have a better understanding of the disease process of asthma, how it is treated, and how to prevent symptoms. Medical disclaimer. This video is not intended to be a substitute for professional medical advice. Please consult your physician with any questions that you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you watched in this video.